As on behalf of the ministry, I want to appreciate this partnership that Softcare has established with us today. And the mothers, babies, children of the country are fortunate today. I don't want to say whether you who are seated in the tent were fortunate because you didn't have this luxury of some of this one. So as a country, it has improved the health facility indicators that we continue to see a slight improvement in our neonatal mortality and teenage pregnancies. I have seen even you adults, you are encapsulated in your coats and jackets. It's very cold. So if you look in terms of diapers, particularly for our neonatal and children hospital, it will prevent hypothermia. So that's their aspect. So whereas for you are encapsulated in your coat and wherever, so we're looking at that this, instead of them not really, wherever their beddings getting soaked or not, with the urine, which so it will help to improve hypothermia, and one of the hypothermia is one of the greatest killer, particularly for the newborn and particularly for the prematures. So the fathers in the house, I want to call you. You are seated next to the fathers. There's one to call them. They need, and if normally when they hand over the baby to the mother, is at that point of time when they want the baby to be what? To change the diapers. So I hope the fathers will take this responsibility of changing diapers for their young ones. For those who are still doing it, but even for those who have grandchildren, this is one of the things we should need to be able to do. I'm sure it's able to get the bone, it helps to help the bone. So the donation definitely is not just for menstrual hygiene and femininity, but rather it regards the health of our girls. And if you looked at one of the major reasons of missing or being absent from school is because of menstrual health hygiene issues. So I am looking at that. If we are able now to track in schools which are going to be supported, probably the rate of absenteeism is going to reduce. But that's not one. Okay, if you need to clap, because it might also help me to stop the rain. When you clap. So
we're here today to launch an official partnership with Softcare, who are manufacturers of diapers, pampers, and wipes, but also pads. We are quite very happy that this partnership has come because it supports a number of people within that we care for. For the sake of babies, it will help mothers to improve the hygiene conditions of babies. In our country right now, the three leading causes of mortality or death of babies are prematurity, complications, asphyxia, and sepsis. But when a baby is born preterm, their body control measures for temperature are not well developed. So those babies tend to struggle with coldness. And so the way we keep those babies matters a lot. But not only for preterm babies, even babies that are delivered at term. When the baby is not kept well wrapped, the baby suffers from coldness. And that coldness contributes significantly to death of our babies. Right now, one of the critical things that we continue to grapple with is the movement of babies from one facility to another facility during times of referral, when the mother, in case the mother is delivered not within the facility, but they have to move their baby to the facility. This partnership at least comes with products that can help us keep these babies warm during the time of their movement. So it's a partnership that we are very, very thankful for. The other piece that this partnership will help us address is providing sanitary towels to girls in schools. Right now, we are realizing that in a number of areas and schools, some of the girls are not able to access affordable pads. But with such partnerships, and the director, the MD this morning highlighted that they are setting up a manufacturing plant in Uganda. And that is quite exciting news, because then we're able to have local manufacturing of these products. And that means that the parents, the girls, and the families will be able to get these products at subsidized costs. The products will be more accessible, and they'll be gotten at subsidized costs. So we will realize that the number of girls that drop out of school because they're not able to access sanitary towels will definitely eventually reduce. This will be quite one of the contributions to that achievement. And thirdly, the other critical products that they are bringing forth are wipes. During the cleaning process of these babies, the change of diapers, the other critical thing that we struggle with is loss of babies as a result of infection. And that is the third most killer for babies who are just born. So it's quite exciting that the products will be available for use by our mothers to ensure that the hygiene conditions that mothers are supposed to ensure while caring for their babies will be maintained with the use of these products. So we are quite very grateful. They have been working with us through a number of campaigns.
Hong Kong stock exchange market. So it's a good news for Softcare development. So we currently can see Softcare, the shareholders from the global market, from UK, America, this big fund, this organization. Currently, Softcare, we focus on the three main products. One is the sanitary pads, one is baby diapers, and the wipes. This three main product is our listed company's main product. We have confidence in Uganda is that you see, when as a businessman, when we choose a countries to develop, first we see the country's environment. And is it convenient? Is it friendly to these investors? But Uganda, compared with most of the countries, as we know, the government are very friendly. The Ministry of Health, of Finance, they give very good tax incentive to motivate us to put more investment. You see, our first factory launched at 2022 February. And then last year, I bought a 30-acre land at Lugazi. So since last month, our new factory from Lugazi, we start our production. So at the end of the year, we are going to provide 300 jobs from the factory. I think maybe today some of the product will still shows made in Kenya. In Kenya, we have also have factories, but I think after 2 months, we will see the made in Uganda, the product come out in the market. And I'm also a Rotarian. You see? From Rotary Union, Club Union. You see, when I joined Rotarian, you see, since I joined Rotarian, Rotary Club, I didn't see any other Chinese who is a member. When I have this idea to be a member of Rotary, because Softcare, in the last few years, we continue to do this kind of CSR. My idea is that my own team, we don't have that good experience to give back to the society. So who is the best one? Rotary Club is the one I can learn from. So I joined this Rotary Club and I start to know how did they run these Rotary programs. So from this, I start to learn something.
It's a great honor and privilege for me to stand before you and the capacity of assistant MD for Softcare. Today, we're officially launching a partnership with the Ministry of Health and the Reproductive and Child Health. It's a milestone for us as Softcare, because Softcare, we're not all about business, making profit. Giving back is also part of our company norms. So we're very glad and eager to have this partnership going. Softcare, we believe hygiene is not a luxury. It is a basic human necessity. Every child deserves comfort. Every mother deserves dignity. and every family deserves access to safe and reliable hygiene products. As a company manufacturing hygiene products locally in Uganda, we recognize that our responsibility goes beyond business operations. We have a duty to contribute meaningfully to the national development and community well-being. It is therefore with great pride that Softcare commits to donating hygiene products with certain value over the whole year for Ministry of Health. These donations will include baby diapers, sanitary pads, baby wipes to support the vulnerable mothers and children served through health centers, referral hospitals, school health programs across the country. We are particularly grateful to the Ministry of Health for embracing this collaboration and for providing guidance to ensure that these products reach these people who need them most. Through this partnership, Softcare joins government efforts aimed at improving maternal and child health outcomes, reducing hygiene-related challenges, and supporting frontline health facilities that serve our communities every day. Ladies and gentlemen, this partnership is also important because it demonstrates the power of public-private collaboration. Sustainable national progress requires government institutions and responsible private companies such as Softcare to work together towards the common social goals. We are encouraged that through this collaboration, Softcare will participate in technical support, visits, hospital outreach activities, and school health programs that directly impact the lives